Welcome to the Every Mom is an Athlete podcast, where we believe that motherhood is inherently athletic. I see you lifting car seats, chasing toddlers, and carrying groceries one-handed while holding a baby and a coffee. Your daily life is a workout. I'm Dr. Karlie, pregnancy and postpartum expert, sports chiropractor, strength coach, entrepreneur, and mom of 3. Here you'll find solo episodes and real conversations with other moms and leading experts, so you can live your strongest, healthiest, most aligned life in motherhood. No matter how long it's been since you've had your baby, whether you're reconnecting with your body, rebuilding your strength, or just figuring out what feels good again, you're in the right place. Hello there, mom athletes. Welcome back to Every Mom is an Athlete. Today, I'm so excited to introduce you to Dr. Laura Morgan-Lee. She is a medical doctor. She's a board-certified sports medicine physician and former professional team doctor who, after her own pregnancy and postpartum journey, realized traditional medical care was, simply put, failing mothers. Leveraging her career experience with athletes, she turned her focus to providing the education and empowerment that women need from expecting to years after baby's born. The vision was clear: bridge the gap to elevate the traditional way medicine is delivered for mothers the same way we care for athletes. Obviously, as soon as I saw Dr. Morgan's info on social media, I was like, I've got to talk to this gal, because we both clearly believe that every mom is an athlete, and we are both treating our patients that way and just having great results. We had such a great time talking about how moms can be treated like athletes, how you can find a doc that is going to treat you in this way and really listen to everything that you need, like for your whole body, right? Like from hormonal health to pelvic floor to injuries that pop up. We just had such a great conversation, and I'm so excited to share it with you. So enjoy. And as always, be sure to rate and review. Would love and appreciate so much 5 stars. And share this with your mom friends who also need to know that every mom is an athlete. All right, I am here with Dr. Morgan. Dr. Morgan, thank you so much for joining us today.
Hello, how are you?
I am doing so great. I'm so excited to talk to you because when I found her, I think Instagram honestly just served you up to me. And I was like, yes, this lady looks awesome. Because it was like doctor, athlete, mom. And it was like, you must know this woman. So I'm so excited to get to know you more. Why don't you give us a little bit of a rundown, tell us a little about yourself, and then we'll start talking about our favorite topic, mom athletes.
Yeah, it's funny you say that because actually someone else told me almost the exact same thing last week. She was like, I hadn't found you. And then you popped up and I was like, oh my God.
Yeah.
And it was like this match made in heaven. So yes. Hi, everyone. My name is Dr. Laura Morgan-Lee. I am a board certified sports medicine doctor and I specialize in moms. So after my own pregnancy and postpartum journey, I kind of had this realization, this huge gap in care. And I used to take care of high level athletes. I used to take care of professional athletes. I used to take care of some of the greatest in our generation, I say. And I realized after my own experience that there was this gap and I had the answer essentially. So if we apply the principles of taking care of moms like athletes to moms, it works and it makes them be strong, have longevity, function, all of the things that you preach in your business as well, taking care of ourselves, growing as athletes, being strong. And it is just a lot of fun and absolutely amazing to do.
Yeah, I love that. I know it feels like such a far transition probably for some people from the outside looking in. Like I used to be the team chiropractor for our rugby team here. It sounds like gigantic rugby players. And now we're talking about moms and little babies. But you're right. I think the principles overlap, right? Like they overlap so much. And when you start to really treat and think of yourself even as an athlete, I think everything changes.
Yeah, so I was assistant team physician for the Cleveland Cavaliers basketball team in the NBA. I worked with the NHL, the LA Kings hockey. I worked with Division I colleges. I worked with high-level triathletes,
So many.
world level, Olympians. This is my job. And through personal life experiences, whatever happened in this transition, and I had this realization, the science supports that motherhood is like sports. So pregnancy and postpartum has been compared in many research articles to physiologically similar to that of a high-level sporting event, right? Because the metabolic equivalence, the METs, is very high, and the demand on our bodies, the hormonal changes, and then the birth itself is this traumatic injury. Even if you have, I always had this time, if you have the most beautiful, ethereal, whatever birth, it's still a trauma physically to your body because it's an insult of change, right? And if you apply the principles of taking care of all mothers like athletes, if you take that multimodal approach that we have for athletes, the different disciplinaries, as you said, the chiropractic care that they have nutritionists, they have wellness experts, they have physicians like myself, they have orthopedic surgeons, they have massage therapists. They have such different approach, but they also have a very unique approach mentally to how we care for their bodies, right? And motherhood is a sport. You said that just now. Motherhood is a sport. We are training, we are exercising, we are taking care of ourselves, we are like trying to achieve and do in so many ways similar to athletes that once you do put it together, it's a no-brainer. But when you first hear it, you're like, wait, what? But yes, when you think about it, no person that I've talked to since I started doing this has been like, that doesn't make sense.
Right.
Every time I say it, like, oh my gosh, yes, yes. Like I was just carrying my 50-pound, kid with my other 2-year-old, and like I was doing this or I was doing that, or I want to exercise and I don't know how to do it, or I felt like I was ignored postpartum and I'm an athlete, or like all of those things that we hear, social media, wherever, like no one has been like, no, that doesn't make any sense.
Yeah.
Like, 'cause it does. It makes total sense.
Yeah, I think I saw a post maybe that you put up the other day of, maybe you can like catch what I'm saying here. Cause again, I have mom brain, right? With my 6-month-old, I'm like, I think I saw, so, okay. It said something along the lines of like pregnancy being like your training and birth being like your event. And then postpartum being like, do you know what I'm talking about?
Yeah, exactly. So I talked about that same similar subject. I don't remember exactly what post, because I also have mom brain with my twins. I think that like it just, mom brain is a part of the syndrome, right?
Yeah.
Yeah. So I think about pregnancy as like the training process, right? You're training, you're mentally preparing, you're physically preparing, you're making decisions that are based off what your short and long-term goals are. That is like training for an event, right? It's a training for this insult, this injury that you know is coming, this trauma. The good news is
Insult. I
it's
think
coming.
we should start calling birth an insult. It is an insult.
It is. When I said it one time,
I know
people
what
were
you
like,
mean.
it feels ooey, like people that like find birth to be this very like cosmic thing sometimes. And so saying like insult or trauma, people are like, well, but like physically it is. Anyways. And so like you're training for that event. You're training for birth to be the Olympics of your pelvic floor, if you will. It's like it's the event. But it doesn't end there. Like if you're someone who's a high level athlete and you have an injury, this time we know it's planned, or you have a time period where you're going to have a time off, you don't just like go time off and go, okay, cool, see you next basketball season, right? And so there's another phase of it that, it's pregnancy, it's immediate postpartum, and then it's everything that you need to do to get back to where you want to be. And I'm not necessarily talking about running marathons. If you want to do that, great, I can help you do that. But if you want to get back to a level of function that you're comfortable with so you can live your life and think about maintaining muscle strength as you get older and maintaining your hip, contour so you don't have weak glutes and have knee pain. And like, if you want to just think about general function, that's important too, right? And there is this phase that we do postpartum where we're like, okay, cool, we're going to go back and we're good, right? Like we don't have to train. And if you think about it like an athlete, you're preparing for your event, your Olympics, your Super Bowl, whatever it is. And then you have to recover, rehab, and rebuild so that way you can continue training again. And you can use the training metaphor for life or for a race or whatever it is. But like you have to physically do that. And if you don't, I would see people in my clinic 5 to 10 years later, women that were active with chronic whatever. And I would think back always and be like, what are we missing? And this is what we're missing. They would have their kids, 5 or 10 years before. They would maybe not get the baby weight off, or they would have weak glutes because they never retrained, or their pelvic floors were shot, or their posture didn't ever recover, the constellation of symptoms that you see in your practice as well, I'm sure. And then they're coming into me with chronic hip pain, and we have so much to unravel to get back. And I want to capture them before. I want to capture everyone before those problems, because I know from my clients, I know from my patients, I know from myself, I know that we can do it. I know we can make it better. We can do it.
I know you. I want to like jump around.
I get so passionate about it. I start
I know.
like sweating.
I'm going to jump around and start singing your praises.
Everybody's going to be leaving. Yes, right?
It is so true though. And I think you and I could just like preach at each other all day about it, because I see the same thing in my practice, right? And I see women that come in and that have had, actually, you know what is so interesting? I see sometimes women who almost feel bad because they feel so good during their pregnancies. And I'm like, no, you like, yes, of course. Sometimes you are sick and there's stuff that we can't expect and we can't predict. But I do see a lot of women who feel really good in their pregnancy. And I'm like, you know what? You've been training, you've been doing your core work, you've been eating properly, you've been sleeping, they're taking care of themselves. And so it's just so interesting that like I've seen people go through that pregnancy, that training phase in a relatively easy way, right? And then I also liken it to like if you're going to have knee surgery, same as you said, you wouldn't just like do nothing. You would like do prehab, and then you would be rehabbing, working on the other side, strengthening the other side. You would be doing everything you could so that once you could start using that knee again, you would get right back into it. And it's the same thing with birth, right? It's the exact same thing.
I
So
needed to ACL surgery when I was like, okay, postpartum of my first, I had a C-section because she was persistently breached. I'm like laying there on the floor. I had a wound dehiscence. Like I'm like laying there and I'm looking at like a whiteboard. Honestly, it's the whiteboard that's sitting beside me on the floor. Still now to this day, I use it. I was like, what if we thought about this like an ACL? And that was one of the moments that started to click for me. I started literally to sketch it out right then at like, 2 weeks postpartum of like, this is how this should function. This is the concepts that are like in my brain. And maybe I was like delusional from postpartum hormones. I don't know. But like that was one of the inciting events of me creating this brand and doing this work is because I was thinking we need to do prehab. We need to train before. We need to train during the event and we need to train after. And something else that you said, like women that are taking care of themselves, taking care of yourself like an athlete is something that we can all do in different ways. It doesn't have to be to run a race or to do a big thing. Like we can all integrate different bits of that. And, my first pregnancy, as you said, is very different than my second. My first pregnancy, I didn't love being pregnant. I'm going to be honest. Like I wasn't one of those people who were like, look at me, I'm glowing. But like I was active. I was walking 3 miles a day. I was strength training. I was fine. I had a singleton. It was, she was breech. We ended up C-section, whatever. But then I had twins and I carried them to 39 weeks. And the differences in those pregnancies, the physical changes was physically so demanding and so eye-opening to me about how people have different, struggles in their pregnancies and like going through it myself. And honestly, there were many times I asked myself, is this going to work? Like, if I'm doing all the things that I know that are right, of all the people that have I should be able to do this, right? Like I have the resources, the knowledge, the support, whatever. But I was still questioning it. And to be able to do that and then go through my postpartum journey and feel as strong as I do now, I know that what we do, taking care of moms, high level athlete demands, physical training, all of the components that we both do, like this is the key. It is what works. It really, really is.
Let's kind of pivot off of that because the way you and I and other, obviously many other professionals.
We get to just talk about us because we're here today.
Yeah, because we're here today. The way we think about postpartum rehab is very different than sort of a traditional postpartum rehab approach of like, wait 6 weeks, blah, 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 blah. So talk to me your thoughts about that. I mean, I think I already know your answer, but what do you have women do when you see them? Let's say, they come in, let's just give an example. They come in, they see you at like week 2, they've had a fairly uncomplicated birth, no tearing or maybe like a grade 1, nothing like too serious. They're feeling good. They trained through their pregnancy. Like, what do you tell this woman?
Well, I think I would have liked to have met her sooner. I'll tell you that. I would have loved to have talked to her in pregnancy because of the things that we can do to set in motion for her postpartum. Sure. I would love to see her before week 2 and start these things. But I'm going to tell her that, yes, 6 weeks. So 6 weeks clearance isn't like this magical thing, right? So your OBGYN is making sure you're cleared from the acute trauma of this birth. There's no like high risk of things like bleeding, affection, whatever. And yes, they ask the 2 questions about, like exercise and sex and they move on, right? And that's not on them. I love my OBGYN colleagues and they and I share this viewpoint. They are so... Healthcare itself is so segregated. We're not going to go down that path right now. But at 6 weeks, they're telling you that. At 2 weeks, I'm going to tell you that like we need to start doing stuff now. We're like, I wish we're starting to, day, if you look at my videos on Instagram, day, 0 in the hospital, I'm up walking the halls. 24 hours both first, I'm starting diaphragmatic breathing and doing core work. Like, we're doing this stuff early. This isn't like traditional exercise. I'm not telling you to pick up some dumbbells at, 2 weeks postpartum when I see you in my clinic. But I'm going to tell you that we can start doing things now that connect you to your body in a way that is going to be there for you as you build. It's setting the foundation. So I believe strongly in doing like pelvic floor PT rehab in the early phase, connecting to your pelvic floor, your core, your breath, building those rehab strategies early on. Once we've achieved those, we have set the foundation for going forward. That can be at 2 weeks. That can be at 6 weeks. It can also be after. If you didn't find, Dr. Karlie or I until 10, 12 weeks, whatever after, that's fine too. We can still do it then. We want to start as early as possible because the sooner you can connect to your core, connect to your pelvic floor, which is what I would tell that person at 2 weeks. Let's start our breathing exercises. Let's start building back our connection to our body. The better off you're going to be. The other one is, light movement. I think one of the biggest things we can do early postpartum is get outside if you're in an area that's safe to do so. And like walking and using that again for your both physical and mental health are going to be key. So those things start early around, as soon as possible up to 2 weeks with this person is seeing me in theory. So by the time you get to 6 weeks and your OB's like, cool, they're going to be like, wow, you look great. They may not even check for things like diastasis or your pelvic floor. That's fine. That's what we do. We don't need any more information. Like we can handle that. But if they get to 6 weeks and they say, okay, you look great, do what you need to do, we already got the ground running and we can start building on that foundation And this speaks to something else that I think is really important that you probably agree with is like, we can't also just stop there. We
Right,
can't do,
right.
I was lucky enough to have a really great rehab experience in my first pregnancy, but we get to, I can like walk and not pee myself. And she's like, great, see you never. And there's this huge gap between, okay, you're cleared for exercise. We're not ready to go back to do everything we ever dreamed of. We still need to build on that, get stronger, do the rebuild phase. Then once you're there, we talk about things like returning to impact, returning to running, returning to heavier weights, returning to CrossFit, returning to whatever, there's so many different phases, but you first with the connection and the rehab and the rebuilding. Then we got to rebuild the strength, rebuild the tolerance to impact. And all of that happens, after the 6 weeks mark. So it's this kind of graded experience from as soon as we can see each other, hopefully in pregnancy, but, early postpartum is great, through wherever you want to be. What does that look like for you? What are your goals?
Yeah, I love that. So many things that, again, I could just like geek out on. But yeah, same thing. I mean, I started with both, oh my gosh, I have 3 kids now. All 3 of my kids.
Oh, no, I
In
do that all the time because I'm like, okay, both of my pregnancies, I have 3 kids. And someone's like, how many kids do you have? And I'm like, oh, wait, I had 3, 2, 1. No, wait, because like, whoa, trust me, the math on that. And sometimes when I'm talking on Instagram, I'll do it too. I'll be like, oh, and with my 3 kids and my 2 pregnancies, and people are like, wait, what?
Yeah, that's
No,
not
really,
right, lady.
really, I got this. I can do this. Anyways, yes, with your 3 experiences.
Yeah, 3 pregnancies. Yeah, I started breathing and bracing in the hospital bed, and I think, I'm sure people come at me and like, I can't believe you're telling people to exercise at 1 week postpartum. I'm like, yeah. Slow your roll. Like, we're not talking about throwing around weights, but the amazing feeling that you get when you're a new mom and you haven't felt your transverse abdominis, you haven't been able to like engage your core in the way that you are used to for, let's call it not quite 9 months, call it 5 months, right? And then you're sitting there and you're like, oh, this is it. Like, I can feel it again. It's such a powerful reminder of who you are and how grateful we can be for being able to build back and like come back to being that person.
I've never been more thankful for how well my body moves until that moment postpartum. When you're lying there, your muscles are all attenuated and stretched. You cannot make your core, you can't sit up.
Right,
but I agree
right.
with you 100%. Like, I'm married to a surgeon, orthopedic surgeon that does trauma, but pelvic trauma. And so like the first thing he and I do in the hospital having these babies, he's like, get out of bed, get her out of bed, get her out of bed.
Yeah.
So if I can tell anybody listening, get out of bed. As soon as your nurses let you, get out of bed, start moving. You don't have to like walk the halls for miles, but like sit up on the edge, do ankle pumps, like start connecting to your core with your breath work. I did it at day 0 in the hospital too. I actually lost a lot of blood in my second C-section with the twins. Different story for a different day. But the nurse that picked me the next morning, so the morning after, she was like, I was looking for you and I couldn't find you because I picked you because you were like the one that was sick, right? Like I needed a blood transfusion. I lost over 3 liters of blood. She was like a float ICU nurse. She's like, yeah, I picked the patient that was the sickest because that's what I like. And I couldn't find you. And the other charge nurse was like, yeah, she's the one walking the hall. And the girl's like, wait, what? And that I 100% attribute to how I took care of myself in pregnancy, to the concepts that you and I understand about postpartum. And yeah, I got very lucky, but I also know how to do this. And so I'm able to get up and walk. I'm able to connect to my core. When I'm at home with the babies, I can pick up both of my twins and like I can move. I can do these things. And yes, it takes a long time to function in the manner that you want. But if you start doing those things early on, just like you said, you are going to start to connect to your body, who you are, what you want. Like that feeling that we all miss postpartum is going to come back so much faster if you do this soon, if you connect. And yes, I'm not telling you to pick up weights. And there's the other side of this coin, like we can talk about too, that like people that go too fast, like there's also a graded progression of this. Like I don't want to see you in the CrossFit gym 2 weeks postpartum. That is less than ideal. There's a reason why we want, to kind of build this back in a stepwise fashion. But connecting to yourself early, hands down, so important and so key.
Yes. Just a quick pause. If you're feeling like your body doesn't feel like yours anymore after having a baby, if you don't know where to start or you're tired of guessing what's actually safe postpartum, I've got you. I created the Postpartum Restoration Plan to give moms a clear, doctor-designed roadmap to rebuild strength, support their core and pelvic floor, and start feeling strong again. It's just 4 days a week, under 20 minutes, and built for real postpartum life. Whether you're a few weeks or a few years out, it's never too late to start. Click the link in the show notes and I'll walk you through it. Along those lines, let's talk about some other, just talking about the 6 weeks and waiting to do nothing and blah, blah, blah. Let's talk about other myths that you find yourself correcting for moms that you work with.
Oh, one of the biggest myths, I actually said someone say this to me on social media. They were like, well, moms aren't athletes. Well, that's absolutely false. Like just yesterday, I was pushing my jogging stroller with 3 children in it that weigh 25 pounds each approximately. How many times have we like lifting things outside and inside of the house while carrying your kids? And I'm thinking about, your long-term recovery and health and well-being here, and lifting properly, using the mechanics, like doing those things and training your body, even if your goal isn't to, be a high level quote unquote athlete, like you are doing athletic things at all times as a mom.
I didn't pay her to say that. I didn't pay her to
No,
say that.
not at all. Like she's not paying me for this at all. This is all just me. I promise, guys, whoever's listening, this is 100% just me. There's a lot of other myths and things about pregnancy training that we could probably harp on too. We've talked a little bit more about postpartum so far, and like I still have friends that come up to me and say, "Oh, my doctor said don't lift over 10 pounds."
Yeah, that one's crazy.
Yeah. Or like, and this is in pregnancy or postpartum, or, like you should not run ever in pregnancy, or all of the ones that
The
said,
heart rate one, I still hear sometimes.
I heard that very recently from an OB that I had a nice discussion about and correcting. This is the ACOG guidelines now that that's not the case. So, and it's not their fault. And again, this isn't like anti-OB because I love my OB colleagues and they're like in the trenches doing the thing. But we shouldn't ask them to manage someone's athletic event no more than I should be managing someone's placenta previa.
Right.
It just shouldn't happen. Now, I know about it, and maybe like if I see it, I can like guide it to them and say, hey, this is bad, you're bleeding, let's do something. But like, I'm not going to be the one managing it. So there are a lot of myths around training in pregnancy that are just simply outdated. And I like to tell people that if your doctor is giving you a statement, a blanket statement, and saying not over 10 pounds, it is 100% okay to say why. Or you cannot exercise, or bed rest. Like these are things that are blanket statements. Now, are there going to be certain instances where they are absolutely indicated? Most likely, yes. There's going to be some patient somewhere that is going to not be told that they should not lift, they should not exercise, they should not run, they should not whatever. And that is absolutely true. But your OBGYN should be able to have an educated discussion with you or your midwife, whoever it is, and give you the reasons why and back it up. And cervical insufficiency, for example, there's going to be more limits on that. But like with my twin pregnancy, I love my OBGYN. We were talking about it and he's like, let me know, keep me posted. There was no like, okay, you can't exercise. And I've been told by other twin moms that they've been told, absolutely, you cannot exercise in pregnancy. It's too dangerous. And that's just not based in science. We actually have new data coming out, and I'm sure you know some of the new research that it supports that like we could actually do more than what we're probably letting people do now, and that heavier exercise during pregnancy is seemingly coming out as safe. We have a lot more work to do in this area, obviously, but there's a lot of myths in pregnancy and as well as postpartum, but a lot more, I think, in pregnancy even, other than the 6 weeks one that we've touched on already.
Yeah, and I think it's so tough. People don't really think about it, but it's hard to study pregnant women, right? And so that's why we don't have all the research that ideally we would have, because it's not necessarily ethical, right, to do some of these studies.
There's so many issues surrounding studying women, pregnancy, this whole exercise. Like the challenges there are extremely difficult, rooted in a lot of different things that probably are out of scope of this podcast. But, whether health inequity comes up or, political engagements or just the way science is, the ethical nature of pregnancy, the challenges that, every bit of pregnancy, you can't just say pregnancy either. It's not like a mole on your arm. There's like first trimester, second trimester, third trimester, they all change. It's all fluid. And what goes into it and how it affects my ability to exercise is my protoplasm before I got pregnant, right? So I was running before I got pregnant with both my singleton and my twins, and I felt very comfortable that I could continue to run in pregnancy until I started to have this body awareness of issues that I thought, okay, now it's probably time to pull the plug. And that's something that you and I need to talk about too, probably, is like, how do people know when their bodies are speaking a language they don't understand a lot of times, because pregnancy is a foreign feeling to most people. But, I felt very comfortable exercising and running in pregnancy. But I am very different than, say, my neighbor, Sheila. I just made up Sheila. She's not my neighbor. Maybe she never ran before. And, so the doing a study or giving her advice about exercise and pregnancy is going to be quite different than me. And that's one of the reasons why you can't look at it in such it's a very fluid experience, right?
Mm-hmm. Yeah. What are some other things that you would sort of, along those lines, you would recommend people look out for or evaluate as far as like what exercises they're doing during pregnancy?
So, there's a couple hard no's, and those are ones that I do believe in, like hot yoga, is something we usually take off the table because of core body temperature. Core body temperature has been shown to be related to issues with women who are pregnant. And, I've had people ask me like, okay, I don't do the yoga in the hot room, but I'm a yoga instructor and I'm in a hot room. And there's always a question that I have to be like, racking my brain on and like working with my OBGYN colleagues on. But in general, hot yoga is like probably something we shouldn't do. We shouldn't be scuba diving. We shouldn't be doing things where impact like falling, contact, hitting yourself is going to be high risk. I had someone who was like 8 weeks pregnant and had a big ski trip coming up and was like a high level skier and was like, okay, I'm going to stay on the bunny slopes again. So there's going to be always some nuance to this. But, those are the things that we really, really avoid. In general, most other things have to be a risk-benefit discussion. And that's where the quote-unquote listening to your body becomes very important. And I say this all the time on social media and in my business, that it's unfair to tell a woman at a pregnancy visit or an early postpartum visit or any postpartum visit for that matter, oh, just listen to your body and go back to do what you were normally doing. Or just listen to your body. Because if you have never experienced pelvic floor pressure before or don't know what the pressure of worsening coning diastasis that feels like. If you don't know what it's like to have a rib flare, if you don't know what it's like to, honestly, like even things like urinary issues, like urgency and incontinence, if you've never had these things before, unless you have the proper language to describe them or you have help in understanding what to look out for when you are exercising, running, for example, you can't ask a woman to make that call herself or to guide without giving her the education and information. I was told, yeah, do whatever you want to do. Well, luckily, I know what I can and want to do, but I also know what those symptoms and things feel like. And without working with someone, having the education, having the resource, having the support, you may not know what your body is saying. And it's just a really complex, and as we just said, it changes throughout the trimesters too, right? So first trimester, second trimester, third trimester, and then postpartum, and depending on the type of birth you had, type of pregnancy you had, like everything is going to be very nuanced. And so it's very difficult to give advice without some nuance. And it's also, as we just said, very difficult to study it because it is so nuanced.
Yeah, I think I generally in my practice, that first trimester, I do remind women like, okay, here's something that you might not know is that your relaxin levels are actually high right now, right? Before you even knew you're pregnant, your relaxin levels are already high. So we want to be careful about your joints, right? But that being said, really nothing else is that different, right? Your body hasn't changed from the outside. It hasn't changed that much. So I don't really change that much in that first trimester when women come in and they're asking, and those are my favorite patients too, by the way. They're like, all right, let's make a list. What can I do?
What can I do? What can I do?
Yeah. And give me some modifications, and there's just a million.
I'm going to give you a very short list of things you cannot do. And everything else is going to be just
Totally.
Hormonally things are changing. And if you may be really fatigued, but the physical outward appearance has not changed and the growth of the uterus has not happened that has adjusted the pelvis and caused muscle issues. None of that has occurred to the point where we have to make specific modifications in your exercise program in most instances. But I also think the first trimester is key, and they are my favorite patients because we're going to set the goal now.
Yeah.
We're going to set the understanding that maybe they come in and they feel like crap. And okay, here's how we're going to talk through this. We're going to set the long game plan. You might start feeling better in the second trimester. You might not. But we're going to start working through why. We're going to set the mental strategies. And I call it the mental game because, sports references.
Yeah.
We're going to see the mental game now because this is a long road, 9-10 months of pregnancy by the time when you get through the experience. And then the postpartum, and postpartum is not 6 weeks long. I know you and I both feel that very strongly. Postpartum, it takes a lot longer than that to get to the function that you want. 12, 18 months. I'm at 17 months now and you're at 6 months. And I know I feel pretty good in my body now. I'm getting stronger, but I'm still working on things that I want to improve and, kind of redevelop that happened because of my pregnancy. And I'm sure you feel the same. You're still in the process of this isn't a 6-week thing. So if we meet in the first trimester, we're going to talk very small about what you can and can't do. We're going to talk a whole lot about what's going to happen as we go through this together and what we can do to set our mind in the right place to understand you're going to have ups, downs. It's going to feel weird. It's going to feel good. We're going to have issues. You're going to, all of these things are going to happen.
Yeah. I always tell my patients, I'm let's say you came in for a shoulder injury. I could pretty well give you a treatment plan, right? I could say, here's how long this is going to take. Here's your diagnosis. Here's what we're going to do to make it better. Bing, bang, boom. And I tell them okay, with pregnancy, you literally come in every week with a different body. And so I can't give you this very strict timeline because you said, things are going to change, right? Some weeks you feel awesome and you're I can take on the world. And the next week, even though you're in your, like you said, in your second trimester, you're I feel horrible. Now it's pulling teeth just to go on a walk and do a couple core exercises. It just changes. It's so variable. But I think having someone like you or like myself, having someone that can help with that and help you set those expectations is really helpful because then and especially as an athlete, for me, my logo is every mom is an athlete, right? And that means two things to me. It means that moms can do whatever they want. There are very high level athletes who go back to doing exactly what they were
Very
doing
high level
before.
things. Yes.
Yeah.
100%. Absolutely
But
possible.
100%. But also, number two is that, like you said earlier, being a mom is inherently athletic. So even if you don't think you are an athlete, you are, because, like you said, you're pushing the stroller, you're carrying the bag, you're lifting up the toddler, you're doing athletic things. So, anyways, I think just like going in and like having that outlook is so beneficial for just all the moms listening. Like, if you can sort of shift your mindset to that, it just, it makes it feel, I don't know, it just like brings some kind of magic to the pregnancy for me and with a lot of my patients too, you know?
Yeah. You work through it as it's going to change. It's going to be a long, if you have the right support, it can be something that you can come out of as strong as you want to be, as healthy as you want to be. It's not going to be, there's no like magic switch, easy. And, again, some other myth back to that, like, oh, it took 9 months to get there, so it's going to take 9 months to get back. Like, that's crap. That's made up. Like, there's like, come on, like, there's no like magic switch at 9 months. Like, there's no magic switch at 6 months. And I also hate the one that, oh, just, start going back to things that you did before. And I'm like, wait,
Yeah.
that's not right either. Just so you're listening, that's not right. Don't do that.
Yeah.
Like, you can't start going back to them, but like, that's such a vague amount of information. You can benefit so much from having more education, support, guidance, taking care of your body in that way. Like, if you want to achieve what you want to achieve, it can be better. Like, for all the moms that find us on social media and they're like, oh my gosh, I've never heard any of this, or this doesn't, like, no one ever told me this, or I felt so horrible, or I never had the support, or I never felt like myself again, or like, I have heard so many things. There's been people, that say even like, I don't even go to my 6-week appointment because it just feels useless to me. Like, there's so many things, and we can do so much better. Like, there are so many things that we have the education for that you and I both know from our experiences, from our patients, from our clients. Like, we can make you successful to whatever you want to be. And you make you just feel better, like feel more supported, feel more understood. Like, what mom doesn't want to feel supported and understood and acknowledged for the pregnancy and postpartum experience that she's in? Like,
totally. And I think, just to piggyback on what you said earlier, the OB, I always tell my patients, because I get a lot of patients coming in that complain, why did my OB tell me this? And I'm like, it is not your OB's job. Your OB's job is to make sure you are safe, make sure your baby is safe, deliver that baby, make sure that you're alive and everyone's healthy. And that's their job. And then it's people like me and you. It's our job to step in and say, let's look at your abs. Let's look at your diastasis. Let's check your pelvic floor. Well, I can't technically check your pelvic floor, but let's talk about pelvic floor health. Let's make these referrals to other providers that we might need. And that's our job. So I just say that because I think that OBs get a bad rap sometimes. And I want to also say in the next breath that OBs should also be referring to people like you and I, especially during pregnancy when they're having pain, when they're asking these questions. I would love to see more of that. It's happening more and more, but I just don't want to like poo on the OBs.
Yeah, no, 100%. This is a healthcare problem. This is not an OB problem. My
100%.
I was at a conference in the spring with a whole bunch of OBGYNs, and they were the best because they're like, oh my gosh, we need you so bad, right?
I know,
like,
right?
They are up to their elbows in taking care of you to the point of getting healthy baby and healthy you. And it is not their job to worry about your exercise program per se. Like, in general, they can give you general guidelines, but they are not experts. They did not take care of a pro team and understand the complex nuances of high level movement. They don't know about the complexities of high level musculoskeletal medicine. As I said earlier on in the podcast, like, I know very little about cervical cerclage.
Yeah, right.
I know it exists. I kind of know what it does. I'm into medical school, like, just like they know about some complex musculoskeletal stuff. But they're not going to be the ones that are managing that. 100% should be someone like this. And I'm hoping that the more conversations like this we have, the more that we talk about this, the more that this becomes something that is a part of the normal dynamic and the normal discussion of pregnancy and postpartum, the more people that see our brands, it's going to make sense. And they're going to be like, oh my gosh, why doesn't every mother, every person that's ever been pregnant, like, why don't they have access to this care? Because they should. And I've met with, people that are high level up CEOs in hospital systems even, and they're like, yes, like this, we need this. Like, why haven't we done this sooner? Like, this 100% should be the case. And it is not the OBGYN's fault. It is a healthcare problem. And yes, OBGYN should have some general support and education and should direct care to us. And they should do things like check diastasis or have an understanding of what that is, but they shouldn't be the ones that regulate the correction of it. That's
right.
just not fair to them.
Right. It's like, you don't want us managing your,
cervix.
Like you said. Yeah, exactly. Not for us.
No, I've been there, done that. And no, thank you. No, thank you anymore. I'm good.
So talking about that, let's talk a little more about what collaborative care looks like for postpartum moms. How do you think that we can all come together as medical doctors, chiropractors, PTs, coaches. Like,
Yeah.
let
This is my
what do you think
dream.
about that? I know, me too.
I lose sleep over this at night, like literally laying in my bed because, okay, you know this well from working with teams. So like at the teams, and some people don't know this. So like when you go to an event, for example, for a basketball team, there is a orthopedic surgeon, there's a primary care sports doctor, there is a lot of times, a neurologist or an anesthesiologist, someone like that on board for concerns of like head and air, definitely for football seasons. Hockey, there's even eye doctors, ENTs, there's emergency trauma doctors. There's all these physicians, first of all. Then, as I said, they have things like chiropractors that come to the stadium before every game to be there and help the athletes. They have massage therapists that are there. They have access to mental health providers that are on call for them at all times. They have athletic trainers, and athletic trainers are the love of my soul when it comes to taking care of teams, right? Because they are like the master puppeteers behind the scenes that know so much about each athlete, can help plug them into the right consultant, the right provider person that you just described. And they all work together. There's a lot of communication. The coaches are involved. Like this is a truly collaborative group effort to take care of these athletes at such a high level. Wouldn't the dream be? And someone asked me this one day, but I was like, sportsdrmorgan.com. That's my website, right? So like, this is where you go. They were like, where do you go for this? And I was like, but like you go this, and suddenly you are a mom and you have access to a chiropractor that understands what you do. You have access to a coach or a guide that can help you navigate this, a lactation consultant, an MD like myself that understands the complexes of like injury preventions and the nuances of what happens when some things do go wrong, or, hormones and, gestational diabetes and all that. I would love to have an OB tied into this as well, because they're going to have their input into the different complexities of it. Like if there is this dream universe where all of these different areas can work together and a mom can go there and access those resources, imagine just what you and I could do combined, let alone adding in all of those other resources. Like, boom, these mothers would be supported in ways that they had never dreamed of being supported. And in doing that, we get them where they want to be sooner, faster, better, easier to prevent those downstream problems. Like, yeah, sure, this isn't about bouncing back. This isn't about looking like you got abs or like doing your cross, your yoga or going back to Orange Theory. This is not what this is about. This is about long-term health, well-being, and function. So that way you don't see me in my clinic 10 years later saying, oh my gosh, my hip is killing me. I can't walk. What's going on? I'm not strong. I have no muscle mass. And then, this comes up often too. The age at which we have our children is getting much older in general. And the nuances between pregnancy, postpartum, ramming right into perimenopause and menopause. And now we're going to have this whole era of women that, are navigating these transitions together. Like, I want to catch you and I want this group of people to work with you so that we can make you your best you for as long as you want to be strong, healthy, taking care of yourself like an athlete, building, doing, living, chasing your kids. Like that's the goal. That's the dream. So if we put all of these collaborative people together, just like we do for high level athletes, wow, it could be absolutely like it could change healthcare for pregnancy and postpartum. It just really could.
Yeah, I know that just is such a dream. I do know in other countries, right, that pelvic floor PT is a part of the program that you like initially meet with the pelvic floor PT in the hospital. It's like part of the whole deal. And I think it's interesting because I'll have people sometimes comment like, pelvic floor PT, what's that? Blah, blah, that's trending now. I'm like, oh my gosh, like, don't even get me started on that. Like, it's so important. It's so valuable. I'm like, oh, because all of a sudden, like, women want help
with
thing.
Their... Yeah, that's the thing. Yes. Trending. But yes, no, I 100% agree and that's a part of the answer. And I have in this business, you can't not, right, have a ton of pelvic floor PT colleagues. And I love what they do and it's very valuable, but it's a part of the puzzle. And I think the brand I am creating and that I have created is supposed to be this like global thought above that. And that's why I think your role is really valuable. That's why I think the pelvic floor PTs is really valuable. That's why I think, having mental health providers involved is really valuable because there are all these different pieces and parts to the puzzle that could really make someone super successful, just like we do with athletes. And it's not trendy. It's not like I'm not doing it because like, oh yeah, I want to whatever. But it's like, it's really the way that we could do it. And the oversight of things like not just the training aspect and you rehabbed your pelvic floor or, you got through the early postpartum or whatever. It's the building and it's the injury prevention. It's the health and wellness. It's the function. It's the nutrition. It's the, worrying about breastfeeding. It's all of those things that if you really package it together, it could be really, 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 really impactful.
Yeah, 100%. Let's transition a little. Let's give our listeners some like very tangible, useful tips. What are a few of your favorite takeaways? Like if you could only tell me like three things, let's say 3 things for pregnancy and 3 things for like early postpartum, as far as like tips, takeaways that just like pop right into your head.
Okay, this is on the spot. So we're going to do it. Number 1 for pregnancy is it's a long game. We're going to play the long game here. We're going to think about the beginning. We're going to think about the middle. Or we're going to think about the end. And we're going to use pregnancy when we're feeling good, probably around the second trimester, to plan for postpartum. Because if you don't plan for it, you're not going to be ready when it happens. No one wants to plan postpartum when you are postpartum. No one like wants to like be 2 weeks postpartum and be thinking, okay, what should I do now?
Yeah.
Not good.
Oh my gosh.
Number 1, that's it. Number 2 for pregnancy, you can do core work. You can't. You just can't. Like,
job.
yeah, like I don't even know what to say about it. You can. Do I want you like, yeah, you absolutely should. I don't want you doing like crazy stuff in the gym. No, but you can do core work. You should do core work. You should connect to your core and we have actually data that supports doing that and that it's beneficial. Number 3, in pregnancy, we can lift weights. You are not broken in pregnancy. Now, there are going to be certain conditions, as I said earlier on, that your OB is going to have the data to back up you not doing this. But if they're giving you a blanket statement and saying nothing over 10 pounds, you're pregnant now, that is not longer proven by science, and we can lift heavy and you can do it well. I would recommend that if you do want to lift heavy, quote, heavy for you, your body, that you are working with someone that understands the mechanics of it, because we also don't want you to hurt yourself, because a hurt pregnant person is not a fun, easy thing to take care of. I have had taken care of people that have like broken patellas in pregnancy, and I just like the idea of that in my formerly pregnant body would just break my soul. All right, so there's 3 for pregnancy. 3 rapid fire for postpartum. Number 1, start breath work early. Connect to your core as soon as possible. In the hospital, start doing your diaphragmatic breathing. They might give you an incentive spirometer, which is one of those like weird tubey things that has the mouth thing on it that you're supposed to like suck into. That's to help prevent pneumonia. You can utilize that as a part of your diaphragmatic breathing if you want, but it doesn't matter. Just start doing it. Number 2, walk as soon as possible. Walk a lot. Get outside when you come home. 100%, you need to move your body in a gentle way. Signs that you're doing too much with walking would be like heavier bleeding, pain, leaking incontinence, things like that. You would want to back off, but like getting physically out the door, even if that's just like walking outside 4 or 5 minutes, standing and stretching your ankles on a curb. I'm saying this story because this was literally me after my first pregnancy. Like that is so good for you physically and mentally. And that's where you start building back from. Number 3 for postpartum is 6 weeks is great, but you can't stop there. If you get cleared to return to exercise and you've done your pelvic floor, you've done your diaphragmatic breaths, you've done your bird dogs or all these other like things you see trending on social media right now, you're probably still not 100% rebuilt to do the things that you want to do. If you've done that, I don't want to see you running 5 miles. I want to see a stepwise return to function, impact, strength, building back to where you want to be so that way you don't get hurt. You know, things like stress fractures do happen peripartum because impact on bone can be so problematic. So building back stepwise over time is absolutely key. And you can get back to doing everything that you want to do. Oh, one other random one. This is like 3.5. Bring the questions that you have for your 6-week postpartum point. This is like really granular on a notepad in your phone, because again, early postpartum, your brain is going to be like mashed potatoes. You're not going to have the thought. You're going to be so tired. If you've planned during pregnancy appropriately and you have like the mentality going into postpartum, the plan set up to take care of you, remember to take care of you postpartum. Start making that list with questions. Have your partner, if you have one, contribute to it. Keep it on your phone so that way when you go back to these appointments that you do get with your OBGYN and you feel confused, rushed, overwhelmed, you have a reference sheet. Because otherwise you're going to get there and be like, I'm okay. And they're going to be like, okay, cool, see you, bye. And you're going to go home and you're going to be like, wait, what? What do I do? I don't know what to do. So use that plan that you made in pregnancy, that long game strategy for postpartum. Don't plan it when you are postpartum, and then make sure you're taking notes so that way when you do have time in front of the providers that you work with. Also for me or for Dr. Karlie, I'm sure she would love that. Just have a list of the questions of what's going on in your body. What do you want to know more about? Because that's what we're here to help with.
Yeah, 100%. I always tell women the same thing. It's like, do as much as you can when you're pregnant. Like I have them make their pelvic floor PT appointment, make an appointment with someone like you or I, get their plan if they're going to do a postpartum rehab plan.
Because you can find out who's like in your insurance coverage, who's not. Like you don't want to be doing that like in the hormone rage of early postpartum. You need to figure that out beforehand. 100%. I do my patients the same way, 100%. And also like talk to whoever you have around you if you have a support system and let them know like, how are we going to support me postpartum? Like, how are we going to take care of me? Like, because there's going to be so much focus on the baby and you are physiologically hardwired to sacrifice everything for that being. Like it's a part of it. So how are we going to take care of me? Do we have day help? Do we have night help? Do we have no help? Are you going to offload me so I can do things to take care of me? Are you going to help me remember to do my core work? Are you going to help me with my water bottle? Do I have my snack tray ready? Like, when can I go outside? Do I have like having a good plan in place so that way you know you're going to make alterations to this plan, but having the framework and setting up as much of it in pregnancy so you're at least as prepared as possible. I say prepared with air quotes on purpose. That will help you be successful too. And don't stop at 6 weeks. We're talking like 6 months plan here or longer. Like what's going to happen? Like, and you're going to make a lot of alterations, but having that plan in place and doing as much of it, like you said, down to the granular nature of calling, like you just said, do it.
Ugh, so many helpful things. Thank you so much, Dr. Morgan. Tell everyone where they can find you, how they can work with you. Give all your deets.
So happy to. That's so happy to talk with you. So I am Sports Dr. Morgan on everything. We'll keep it simple. Sports Dr. Morgan on Instagram, on TikTok. My website is sportsdrmorgan.com. It is about to get the most beautiful refresh ever too, because right now it's a little bit janky. So you can still get me there. I made it myself. And as you can tell, I'm 100% a lot of things I'm not a lot of tech. You can email me, sportsdrmorgan@gmail.com. You can send me a DM, comment on my reels, on social media, whatever. You can find me there. The ways we can work together. If you were in the States that I have a medical license, I can be your physician and we can do doctor care. I can diagnose you. I can treat you. I can do one-on-one. We can do just like this, only whatever's going on with you. If you're a state that I do not have a license in, we do health coaching, and it's a group model where there's like a 4 or 8 week program where we go through different things. There's no diagnosis, but there's a ton of education, information, support. We can do all of the things that can get you where you want to be. And I would love to hear from your audience. Like, what else do you want from me? Like, I have a digital download in the works. I have a lot of fun things coming down the pipeline. I also have a newsletter that you can sign up for on my Instagram or on my website. And if there's something that you want from me, reach out. I am here for you. I'm here to help.
And what states are you licensed in?
So currently licenses in California, Illinois, Ohio, Maryland. So many I have to think about it. And then Virginia and DC by reciprocity will be happening this summer. I also have one in Arizona that is like expired, but I could renew. So if you are in Arizona and you hear this and you're like, oh my God, I need her, just let me know. Or if you're in a different state, or if you have friends and if you're a business owner, if you have a PT or a chiropractor or a physician and you're like, wow, this could be really valuable for my patients, please reach out to me. I'm in the process of growing this and building this, and I'm in the phase where I want input because I want to make this what can really, really, really make a difference. So happy to help.
Love that so much. Thank you so much for your time. We will link everything below, of course. Thank you again.
Yeah, bye. Thanks.
Thanks for listening. Every Mom is an Athlete isn't just a podcast. It's a reminder. Motherhood is athletic, and you're still the athlete you've always been. But it's not about going back. It's about moving forward intentionally and powerfully. If this episode resonated with you, I'd so appreciate it if you'd share it with a friend, leave a quick review, or rate the show. It helps more moms to hear what they need to believe, that every mom is an athlete. See you next time.